I'm starting physiology, right? I'm starting physiology, and I'm going to take this in a systematic manner. Like, I'm going to start from general physiology, so that there are certain concepts which are very very important for your general physiology. Unless and until you uh, know those concepts of general physiology, you cannot move ahead, right? आपको समझ में नहीं आएगा. Suppose वट एवर एक्शन पोटेंशियल्स आर देयर और वट एवर ट्रांसपोर्ट प्रोसेसेस आर देयर, you cannot understand them. So इसलिए it is very very important for us to start with general physiology, right? So what does this general physiology basically includes, right? इसमें क्या क्या include होता है? So basically your general physiology includes yes. So your general physiology basically includes homeostasis, right? Now remember, it is homeostasis and it is not hemostasis. बहुत ही common mistake रहती है. This is a very very common mistake which the students do. This is homeostasis, different feedback mechanisms. Then related to homeostasis, what is the gain of a system, right? Gain of a system. Then you've got important thing, that is you will be also we will be dealing you with cell membrane. ठीक है, cell membrane. Then the different cell adhesion molecules. Okay, the different cell adhesion molecules. What is the cytoskeletal system, and what are intercellular junctions. Then the transport across the cell membrane and the body fluids. ठीक है, so these are the important things which we are going to consider when we will be taking this particular topic. So let's start with a case history. So why am I taking this case history? It is very very important for us that why are we studying general physiology. हम लोग क्यों पढ़ रहे हैं जनरल फिजियोलॉजी, व्हाई इट इज इम्पोर्टेंट, हाउ आई कैन कोरिलेट दिस टॉपिक टू द क्लिनिकल साइड, है ना? Nowadays what happens, everything which is going to come is going to be either in the form of case history, case based scenario, या फिर even the MCQs which you will come across will be the case based scenarios. So it is very important for you to understand that you will have to know the correlation of every topic, of almost every topic with your clinical medicine or surgery. Now suppose I give you a history. A 43-year-old man presents with physician with complaints of epigastric pain. After a thorough workup, the patient is diagnosed with peptic ulcer and he is started on a medication. This medication is known to inhibit the proton pump of the stomach. Right? Now, we know that definitely this is a case of peptic ulcer because the diagnosis is given to you. So, this particular topic I can also take with GIT. We will taking it in GIT but in a different aspect, where I may not tell you that this is peptic ulcer and I may expect that the students should be able to diagnose that. ठीक है? So, what is the proton pump that is referred here in this particular question, right? So exam may, if you are going through your first prof, you will see that you get 8 marks question, or some universities give 7 or 8 marks questions where a clinical case is given and there are questions which are related to that case. ठीक है? So what is the proton pump that is referred over here? What type of cell membrane transport is supposed to be blocked by this treatment? That means this proton pump inhibitor, जो ये medication आप दे रहे हो, it will inhibit which type of transport mechanism? And you may be asked anything else related to it, like what are the different types of transport across cell membrane and so on, right? Now this is a kind of a case history which is related to this topic, and we will be completing this case history, or you yourself will be completing this case history once we are completing our topic, or when we reach there we'll be trying to solve this. Now similarly, what other important aspects are there? ठीक है, आपको ये भी पता होना चाहिए कि और क्या इस पर्टिकुलर टॉपिक में इम्पोर्टेंट है, राइट? सो इट इज नॉट ओनली I can ask you this, I can ask you different other things also. जैसे suppose I give you a flashcard. Define the equation which is used to determine the rate at which the molecules pass through the gases or solution. So what is that equation, right? What is that equation which helps you to know the rate of diffusion, right? So rate of diffusion, सबसे पहले आपको समझ में आना चाहिए कि when I say diffusion, it is definitely related to your transport mechanism, and whether it is active, whether it is passive, this we will be going through. How the cardiovascular or the GIT or the respiratory system take advantage of the Fick's law. ठीक है, that means यहाँ पर जो diffusion पूछा गया था, that diffusion is related to Fick's law which we will be dealing with. And this, though it is a very simple topic from physiology, right, from general physiology, but is Fick's law that tells you about the simple diffusion. How is this applicable in other systems, like it could be GIT, it could be cardiovascular, it is even respiratory system, जहाँ पर ये simple principle of diffusion is very very important. And how can celiac disease be considered as a Fick law defect? Very very important. This is a very typical picture of even the next pattern where a clinical scenario is given, where you may be given that it is a celiac disease and you may be asked a very simple basic physiology, that which diffusion is affected or how Fick's law is related to it. ठीक है, सो डोंट अंडर एस्टिमेट योर जनरल फिजियोलॉजी. बिल्कुल भी आप अपने जनरल फिजियोलॉजी को अंडर एस्टिमेट मत करो. This is a very very important system which carries LAQs, MCQs, which also carries very important weightage in the entrance examination. ठीक है now. So what are the probable questions which can come from this as far as your first MBBS is concerned? Describe the functions of cell membrane. Describe and discuss the various transport mechanisms across the cell membrane. Draw a well-labeled diagram of sodium-potassium pump, or what is glued, or what is simple diffusion. ठीक है, so these are the questions which are probably related to this. Especially transport across cell membrane is a very very important LAQ. बहुत इंपॉर्टेंट LAQ है ये, which is repeatedly asked. अगर आप देखोगे भी अपने पुराने questions तो you will see that this is taken in the exam. So let us get started with the cell membrane first. Very very important topic, that is your cell membrane. Now what is the cell membrane? Basically it is a lipid, okay, it is a lipid bilayer. Why do you call it as a lipid bilayer? Because you can see that there are two layers of 1 and 2. There are two lipid layers, and intervened in those lipid layers you will see that there will be proteins. So this is a particular model where there is lipid and there is protein. This is also called as a fluid mosaic model. Okay, it is also called as a fluid mosaic model, where the fluid portion is the lipid. ठीक है, the fluid portion is the lipid and the mosaics are the protein. So the fluid portion is the lipid and the mosaics are the protein. One minute, just a moment. I think this is not connected and therefore I'm not able to write with it. Just give me a moment. Yes. Okay. Now, okay. So this is the fluid mosaic model. Right. Now, इसमें you can see that over here right, over here you will see that this is the phospholipid layer which has got a polar end. That means a hydrophilic end. This is the hydrophilic end. Now अगर आप ध्यान से देखोगे तो you will see that the hydrophilic end is over here as well as the hydrophilic end is over here. दोनों तरफ पर there is hydrophilic end. So the polar ends or the water loving sides are present both facing the exterior as well as the interior. That means one which is facing towards the external surface and the other which is facing towards the cytosol. Okay, the other which is facing towards the cytosol, अंदर की तरफ. And this is a kind of a structure like एक pin होता है. There is a head of the pin and there is a tail. So this is the head of the pin and this is the tail. And these tail portions, they are hydrophobic. Excuse me. They are hydrophobic or the fatty acid tail portions. So how are they aligned? The head portions are present on either side, one towards the external surface and the other towards the internal surface. And the hydrophobic or the fatty acid portions, they are aligned in such a way that they are opposing each other. They are present opposite to each other. Now, the very important property of your lipid bilayer is that it is only permeable to lipid soluble substances, right? It is only permeable to lipid soluble substances. So the most important property is that it is only permeable to lipid soluble substances. Now this is very important, that how it is only permeable to lipid soluble substances. अब देखो, how will the lipid soluble substances pass through? Between these two heads there is going to be this intermolecular space. So from this intermolecular space, okay, from this intermolecular space, the lipid soluble substances can easily penetrate through. So this membrane is selectively permeable. It does not allow any water or water soluble substances to pass through. The only substances which can easily pass through are going to be your lipid soluble substances. ठीक है. Now you can see that there are lots of other structures which are present, and these are your proteins. So you have got two types of proteins. One, the peripheral proteins, and the other which is called as the integral or the transmembrane proteins, right? The integral or the transmembrane proteins. Now this peripheral protein is the protein which is going to be present either externally, that means facing towards the exterior, or internally, that means facing towards the cytosol. मतलब या तो वो ऊपर की तरफ होगा facing outward, या फिर वो अंदर की तरफ होगा facing the cytosol. It will not penetrate through the thickness of the membrane. ऐसे penetrate नहीं होगा. Either it will be present over here externally or inside internally. It will not penetrate the cell membrane, and therefore it is called as a peripheral protein, because this peripheral protein is not able to penetrate the entire thickness of the membrane. So there are many proteins which are going to be present only on the peripheral side, and there are going to be proteins which are going to pass through and through the membrane, right? So those proteins which are only on the peripheral side are usually working as the cell adhesion molecules. Okay, they are cell adhesion molecules basically, or some of the receptors. Whereas these are very important, the transmembrane proteins or the integral proteins or the pores. ये क्या करते हैं? These can behave either as receptors. Then G protein, later on we will study what is G protein with endocrines. So G proteins हो गए, integral proteins में carrier proteins, pores, channel, pumps, ये सभी जो होते हैं, the pores, the channels, the pumps, these are protein in nature, और इनके through the various transport processes are going to take place, right? So the cell adhesion molecules are the peripheral proteins. RBC has got very specific peripheral protein that is called as spectrin. Okay, spectrin, very important, anchorin, very important, peripheral proteins which are important for the shape and the structural integrity of the RBC. ठीक है? And all the carriers, the enzymes, through which the diffusion takes place. The facilitated diffusion, the pump, the pores, they are all examples of integral proteins, right? So the first important feature is that you have got a lipid bilayer, हाइड्रोफिलिक एंड है, हाइड्रोफोबिक एंड है, ठीक है. Then the only lipid soluble substances can pass through, and they are going to pass through the space which is present between these two head portions, through this intermolecular space. These lipids are amphipathic. Why they are amphipathic? Because they have got both lipid soluble as well as water soluble portion. Remember, even the proteins are amphipathic. These integral proteins का जो central वाला part होता है, which is embedded or which is passing through the membrane, this portion is also amphipathic, means it is lipid soluble. Okay, that portion is lipid soluble, which is easily entangled or captured between the lipids, right? Now, something very, very important in your cell membrane is cholesterol. Very, very important. What is the utility of cholesterol in the cell membrane, right? It is very, very important. Remember, this cholesterol maintains the transition temperature of the cell membrane. Okay, the cholesterol maintains the transition temperature of the cell membrane. Now, what is this transition temperature? I told you that this is a fluid mosaic model. So fluid mosaic model का मतलब क्या होता है कि there is fluidity in the membrane, and this fluidity in the membrane is very, very important because it maintains the lateral diffusion of the proteins as well as of the lipids. Okay, so they are dynamic structures, they are not static, they show lateral diffusion. Now this cholesterol is in the position to maintain the temperature or the transition temperature. That means the adequate fluidity of the membrane is maintained by your cholesterol, right? For example, just take butter, Amul butter, and you just keep it in fridge. It becomes very solid. And the moment you put it on a hot bread, slice of bread, it is going to melt, right? And that fluidity is very important for the functional activity of the cell membrane. Okay, now this membrane ka composition, if you see, the maximum composition of the cell membrane are proteins. Okay, the maximum composition of the cell membrane is protein. 55% are proteins, 40% lipids, and carbohydrates 5%. Okay, so the maximum mass is made up of your proteins. The cholesterol molecules are arranged in between the phospholipid molecules, and remember that the cell membrane is a fluid structure. It is not a solid structure, because this is very, very important to maintain the enzymatic reactions and the various transport mechanisms that take place. So the cholesterol molecules, they are arranged in between the phospholipid molecules, right? What can these cholesterol molecules do? They pack the phospholipids in the cell membrane. So if the temperature is more, that means if it is liquefied, what they will do? They will get the phospholipid molecules together. They will hold them back together, pack them. But if the temperature is less, if it is a cooler side, what they are going to do? They are going to separate the molecules of the phospholipid. So this is responsible for the structural integrity and the various enzymatic reactions which take place in the cell membrane. The very, very important functional significance of your lipid bilayer is that because the membrane is lipid, it is permeable only to lipid soluble substances. This is a semi-permeable membrane, or you can also say that it is a selectively permeable membrane. और इसका importance क्या है? The membrane is permeable to some substances and it is not permeable to some other substances. इसीलिए क्या होता है? That inside the cell and outside the cell you have got two environments. You have got ECF and ICF. The composition of the ECF will always be different from the composition of ICF. That is possible because of the selective permeability nature of the cell membrane. And उसी के वजह से you are able to develop the resting membrane potential, which is responsible for your action potential. मान लीजिए अगर आपकी सेल मेम्ब्रेन हर एक सब्सटेंस को परमेबल हो जाएगी, ठीक है, अगर वो हर एक सब्सटेंस को परमेबल हो जाएगी तो क्या होगा, the difference in the potential will never be created. You will have never an adequate resting membrane potential and never an action potential. So one of the most important feature that contributes to the resting membrane potential is the selective permeability or the semi-permeability of the cell membrane, which we will be dealing with our next lectures. So because it is a lipid bilayer and allows only fat soluble substances, you will see that gases can easily pass through, alcohol can easily pass through, but it is a barrier to glucose, urea and electrolytes. And because it is a barrier, it also creates an osmotic gradient, and therefore water also passes by osmosis only because of the phenomenon of this lipid solubility, where certain substances will be coming in more easily as compared to others, right? So this this important thing must be considered and must be remembered. Now as we've already spectrin in RBC is associated with hereditary spherocytosis. Hereditary spherocytosis. Yes, JA, I will take that point also. Anti-phospholipid, I will deal with that also. Right? Anti-phospholipid syndrome. I will teach you about that also. Just give me time. Okay? Anti-phospholipid syndrome. I just make a point so that I remember that I have to deal with this anti-phospholipid. So don't worry, I'm going to take that also, the significance of that also. Is it okay, JA? Because your name is not written, so JA. Okay, is it okay, beta? Is it? Yeah, good. And spectrin, it is associated with hereditary spherocytosis with the lack of spectrin. Now again, two type of proteins. You can see the integral proteins which can traverse the entire thickness of the membrane, and I told you that the yes, I will deal with that. Let me complete this, let me complete this physiological part, and then I'm going to take you through the pathophysiology of that also. Okay, J. The integral proteins are also amphipathic in nature. Okay, and the peripheral proteins, they are embedded and they do not penetrate. Now, the integral proteins, okay, the integral proteins, they are very important channels, okay, they are very important channels for the diffusion of substances which are not lipid soluble. Whereas the peripheral proteins, they act as cell adhesion molecules, but sometimes they can also act as antigens and enzymes. Very important examples and also MCQ related. Integral proteins are your G proteins, pumps, channels, and the peripheral proteins are spectrin and the cell adhesion molecules. Now, if you just go through the functions of cell membrane, which is very important, 2 marks BAQ if you are appearing for your first MBBS exam. Protective function, we all know that it is very important protective cover to the cytoplasm and protects the inner organelles. And as I told you, the significance of semi-permeability, which is responsible for the establishment of the resting membrane potential and therefore the action potential. It takes a very important role in absorptive function. Remember, you have got GIT, you have got respiratory system, all these membranes, they can show absorption because of the absorptive lipid solubility nature of your membrane. It is also performing an excretory function. It is very important for the exchange of gases. Very important to give a confined shape and size to the cell. Okay, right? So, these are the important functions of cell membrane if you have to appear for a 2 marks BAQ in your university. Now come to very important topic, that is intercellular junctions. Remember, this comes even as an image based question when we are passing through our examination. That means when we have to give our NEET-PG. Now remember, there are two important concepts to be understood. First is intercellular junction and one is intercellular communication. Both are different. right? Both of them are different. Intercellular junctions and intercellular communications, both are different. Now these intercellular junctions are what? These help in the attachment of one cell to another. Okay? They help in the attachment of one cell to another, or they help in the attachment of the cell to the underlying basal lamina. Okay? And there are some of the cell junctions, for example the gap junctions, which actually also help in the passage of substances from one cell to another, right? This comes as MCQ, very important topic, and even short note में first MBBS में this is an expected topic. Now, the first very important cell junction is what we called as the tight junctions. See, you can see this bluish color, that is tight junction, right, which is present towards the apical side of the cells, not on the basal side. Okay, it is present towards the apical side of the cell, which is called as tight junctions. The commonest site where it is present, okay, जहाँ पर commonly ये present होता है, are the epithelial cells. Remember, the apical, not the basal. The epithelial cells of your intestinal mucosa, of your renal tubules, intestinal mucosa, your renal tubules, the blood-brain barrier, and it is made up of certain important proteins called as claudins and occludins. It is made up of proteins which are called as occludins. Now, though it is called as a tight junction, is it actually tight? Is something to be considered? No, it is not tight. It allows water and ions like sodium, potassium, magnesium to pass through it. So when we will be studying our systemic physiology, I will teach you, like in GIT or in kidney, that there is paracellular diffusion. Paracellular diffusion means the diffusion which is taking place between two cells. This is one cell, this is another cell. Okay, so दो cells के बीच में से जो diffusion होता है, right? दो cells के बीच में से जो diffusion होता है, that is paracellular diffusion, and that paracellular diffusion takes place with the help of tight junctions. And wherever these tight junctions are present, like in the intestinal epithelial cells, lots of absorption of the ions and water can take place through the tight junctions. So even though they are called as tight junctions, but remember, they are not completely tight. They may allow ions and they may allow water molecule to pass through it. Then the second important ones are what are called as the adherents and the desmosomes. So these adherents are made up of actin, and there are desmosomes. Now these desmosomes are very important. These desmosomes are especially present in those areas or those tissues in the body which are subjected to lots of stretching. Can you tell me any of the areas where they could be present? Okay, or tell me any of the areas where there is lots of stretching and jahan par you can get the desmosomes. Yes, anybody can answer? Where are you expecting desmosomes? So these desmosomes are present in the areas, especially where there is lots of stretching, like heart. So they are present in heart, that is the cardiac muscle. They are present in uterine cervix, right? They are present in uterine cervix. They are present in heart. The two important sites. Then you have got hemidesmosomes, which are also called as half desmosomes. These hemidesmosomes are connecting the cell to the underlying basal lamina. Okay, they are connecting the cell to the underlying basal lamina. And finally, very important are the gap junctions. These gap junctions are actually also called as cytoplasmic channels. Okay, they are called as cytoplasmic channels because they help in the passage or the transport of solutes from one cell to another. And apart from solutes, they also help in the transport of action potentials. right? Action potentials, electrotonic conduction, action potentials can travel. So the gap junctions are present in your cardiac muscles and in your SA node. Sorry, cardiac muscles and smooth muscles. Obviously in the SA node itself, in the cardiac muscle, in the conducting tissue, especially in the SA node, you will get it lots in the conducting fibers like the Purkinje fibers. And because of the large number of gap junctions in the Purkinje fibers, the conduction velocity is maximum in the Purkinje fibers. And smooth muscles are another important site where you're going to get the gap junctions, right? So these are your intercellular junctions, which include your tight junctions, okay, which include your gap junctions, desmosomes and hemidesmosomes. Now, this is also a very beautiful figure. This figure is taken from Genong, and many times I have seen that the image-based questions have come, from this figure. So therefore, I've taken this figure. You can always keep it in your, in your mind, or obviously you'll be getting a PDF of this particular lecture. So, is PDF ke through you can keep this tight junctions, adherence, and the other text which is given over here. Now, what is intercellular communication? Right? Intercellular communication. So, intercellular junctions are what? Junctions means how the cells are connected to each other. Communication means how do they communicate with each other, right? How they communicate with each other. The first important is autocrine. Autocrine. What is autocrine? Here a particular cell, okay, a particular cell will release its content. Suppose there is a cell which releases prostaglandins, and the prostaglandins will act upon the same cell. Okay, the prostaglandins will act upon the same cell. This is autocrine. Second important is paracrine. What is paracrine? Where one cell is secreting and that substance is being acted on the neighboring cell. That means suppose there is a cell A. Cell A is secreting histamine, okay, or cell A is secreting somatostatin, and that particular substance is getting acted upon, or that substance is acting on the neighboring cell. A very important example. A very important example which is associated with the with paracrine and frequently asked is somatostatin. Somatostatin is very important because somatostatin acts, or it is supposed to be a very important neighboring paracrine inhibitory hormone. JA, desmosomes are made up of cadherins. Desmosomes are made up of cadherins. Okay? They are made up of cadherins. JA, can you tell me what are you preparing for? You're preparing for NEET-PG, you're preparing for UG, or you're preparing for FMG. What are you preparing for? Yes, JA. What are you preparing for? Yes? Okay. So intercellular communication is autocrine, paracrine and endocrine. What is endocrine? Which is secreted by the ductless glands into the bloodstream and acts on the target organs. Now, okay, you're preparing for USMLE. Great. Now, let's come on to a very important topic, that is transport across the cell membrane. Now let's start with this MCQ. When an ion moves down its concentration gradient, it is called as which type of transport? Primary active transport, secondary active transport, facilitated diffusion, or endocytosis? Yes, so when the ion moves down its concentration gradient, this is an example of diffusion. Okay, a kind of diffusion which is passive. Passive means you do not require energy. So in the examples which are given, like the primary active transport, the secondary, the facilitated and the endocytosis, over here it is the facilitated diffusion which is passive. That means it does not require energy because the substances are moving down their concentration gradient. So the correct answer is facilitated diffusion. Okay. Now let's consider what is the various transport mechanisms across the cell membrane. Now, basically transport mechanisms across the cell membrane can be classified as active and passive. Right? Active and passive. Active is called active because it utilizes energy. Right? Active is called as active because it utilizes energy. It is active because the substances are moving against their concentration gradient. Right? They are moving against their concentration gradient. So it is an active process where the substances have to move against their concentration gradient, right? And it is utilizing energy in the form of ATP by the breakdown of ATP. The transport process can be either primary or secondary. So I'll be showing you figures of what is the primary transport and what is the secondary transport, right? It can be either primary or it can be secondary. It is a very metabolic process. Why it is a metabolic process? Because you are using energy in the form of ATP. You are breaking down the energy and therefore it is a metabolic process. The passive transport is passive because there is no utilization of energy. The substances are moving down their concentration gradient, right? So from high concentration to low concentration, they are moving down their concentration gradient and therefore it is a passive mechanism. It is a simple method by which the substances are moving down, right? Moving down their concentration gradient from high to low without utilization of any energy. So it is a physical process. It is a simple physical process, right? Now, what are the various examples of the transport mechanisms? Now, if you consider your simple or your passive transport, it is diffusion and osmosis, right? It is diffusion and osmosis. Diffusion includes a simple diffusion and a facilitated diffusion, right? Simple diffusion or a facilitated diffusion. Now, what is simple diffusion? See, you can see that on the side A, there is more concentration of substance and on the side B, there is less concentration of substance. And a very important feature is that these two compartments are divided by a semi-permeable membrane. The membrane has to be semi-permeable. If it is fully permeable or if it is non-permeable, then you will not, you will not be able to get the diffusion. So the substance which is in high concentration will move down its concentration gradient. That means the substance will move from A towards B. Now it can be either a concentration gradient, it can also be a pressure gradient. See, we take in oxygen. Why do we take in oxygen? Because oxygen is more in the atmosphere and therefore we are taking in. So moving down the concentration gradient, right? Or it can even be a temperature gradient. Like if you increase the temperature, then also the random movement of the molecules will increase. Basically, what happens with diffusion? There is simple random collision of the molecules which is causing them to just move down their concentration gradient. Now, this simple diffusion can be very well depicted with the help of a figure. Okay, yes, with the help of a very important graph, right? So we take on to this graph. Can you see that this is the graphical representation of our simple diffusion and facilitated diffusion, right? A graphical presentation of the simple diffusion and the facilitated diffusion. On the x-axis, you've taken the concentration of the substance to be transported, and on the y-axis, you take the rate of diffusion. And when there is a linear correlation, that means you keep on increasing the concentration, the rate of diffusion will increase along with it. Okay, if you keep on increasing the concentration, the rate of diffusion will increase. This is what is simple diffusion, where there is no saturation kinetics. There is no saturation kinetics. A very, very important feature of simple diffusion is that there are no saturation kinetics. If you keep on increasing the concentration of the substance, the rate of diffusion will increase along with it, right? So this is simple diffusion. And simple diffusion is seen by which substances is a very important question. So simple diffusion is going to be a part of your only fat soluble or your lipid soluble substances. Now, see, this is what is simple diffusion, whether on the x-axis we've taken the concentration gradient and on the y-axis we've taken the rate of diffusion, and we see that we keep on increasing the concentration gradient, the rate of diffusion will increase. Now, if you look upon to your facilitated diffusion, okay, it is totally different. Here you can see that in facilitated diffusion, there comes a word called facilitated. That means there is something which is facilitating the process. That facilitator is nothing but it is a protein, or it could be a channel. The channel is also made up of protein, which is allowing the substances to pass through, right? Now again remember, although facilitated diffusion is using a carrier protein, it is not using energy. A very, very common mistake which is made by the students, that we think that we are using a carrier protein. So the moment we think that we are using a carrier protein, there comes the role of energy, but it is not like that. So look over here, this is a semi-permeable membrane. This is the protein which is taking part, okay, the carrier protein. Now you can see that the carrier protein has got a binding site, okay. This is the binding site for the substance that is going to be transported. Now as the substance that is going to be transported binds on this site, what happens? What happens? There occurs a conformational change in the carrier protein. I hope you are able to appreciate the conformational change. ये देखो, just look over to the shape of the protein when the substance was not bounded, and how does the shape of the protein becomes when the substance gets bounded. Very important. So with facilitated diffusion, as the transported molecule will bind, there is going to be a change in the conformation of that protein or the carrier protein, and the substance will be released towards the interior. Okay, the substance will be released towards the interior. Right? Now, what are certain very, very important features of your facilitated diffusion? Please make a note and remember this very nicely. Now, first important thing, it is using a carrier protein, right? Anything which is using a carrier protein will always be subjected to saturation. What is that? Now suppose there are 20 molecules to be transported, right? And you have got only 10 transport carrier proteins. What will happen? 10 will carry 10, and what will happen to the remaining ones? They won't be absorbed, or they won't be secreted, or they are not transported, because there is deficiency of the carrier proteins. The substances to be absorbed becomes much more than the available carrier proteins. So that means that facilitated diffusion is subjected to saturation kinetics. This is the reason that why in diabetes, okay, why in diabetes, what happens when the patient has got diabetes? When the patient has got diabetes and the sugar crosses the renal threshold, that means it crosses the reabsorptive capacity. 100% glucose molecules are not reabsorbed by the renal tubules, and the glucose appears in urine, which we called as increase in the clearance of sugar in urine. Okay, we called it as increase in the clearance of sugar. In renal physiology, this is termed as renal clearance is increased. Normally, the renal clearance is zero. No amount of sugar is ever excreted in the urine. But when in diabetes, the saturation occurs of the carrier proteins which are called as SGLT. 100% glucose is not reabsorbed, and therefore the glucose comes in urine, or we can say in terms of renal physiology that the clearance of glucose increases. So the first important feature is facilitated diffusion uses a carrier protein but no energy, and it is subjected to saturation. Then another important thing, it is subjected to competitive inhibition. Very, very important. Now there is a carrier protein which can bind to both glucose as well as galactose, or there can be carrier proteins which can bind to same, the two drugs can be there in pharmacokinetics which are binding to one carrier protein. So it is subjected to competitive inhibition, right? So there is saturation, there is transport maximum, there is competitive inhibition, and there is something which is called as stereospecificity. What is that? Do we remember that when in our childhood we had a game, we used to play with shapes. So there's going to be a star which will fit in the star shape, or an oval which will fit in the oval shape. That means there has to be specificity in the structure of the membrane, right? In the structure of the membrane receptor and the substance to be reabsorbed. JA, increased glucose does not damage the nephrons. Okay, it does not damage the nephrons. Whenever there is an increase in the glucose, right, the renal threshold is crossed. Glycosuria can damage the nephrons, which we call as the nephropathy or the diabetic nephropathy which occurs. Okay, diabetic nephropathy. You know that increase in the glucose can cause glycosylation of the proteins. So the late complication will be the diabetic nephropathy, which can occur with uncontrolled diabetes, and not so easily with uncontrolled diabetes, right? JA. Okay, so the last feature we considered is that it is showing stereospecificity, right? So it is using a carrier protein, but there is no use of energy. It is subjected to competitive inhibition, saturation kinetics, and shows stereospecificity. Yes. So this is facilitated diffusion. Okay, this is facilitated diffusion. This was the graph which was depicting our simple diffusion, a straight linear correlation. But you can see with facilitated diffusion, you get this plateau. Why do we get this plateau in facilitated diffusion? This plateau means that there is saturation of the carrier proteins, and now even if you keep on increasing the concentration of the substance, the rate of diffusion is not going to match with that, and therefore there is a plateau, which is an indicator of saturation of the carrier proteins, right? Now, we started with this question. If you remember, boys and girls, I started with this question that the first question I took when I started the lecture, that what law is there, okay, what law is there that is related to diffusion. So one of the very important law that is related to diffusion is fixed law of diffusion. Fixed law of diffusion. So the moment you get fixed law of diffusion, remember it is associated only with simple diffusion. Okay, it is a feature of simple diffusion. Now, fixed law says that J is equal to P into A in brackets C1 minus C2. where J is the net rate of diffusion. Okay, J is the net rate of diffusion. P is called as permeability coefficient, and in some books you will see D, which indicates a diffusion coefficient. So whatever book you are remembering, if it is P, it is permeability coefficient. If it is D, it is diffusion coefficient. Both of them depend upon same factors. A, surface area of the membrane. Okay, A represents the surface area of the membrane, and C1 minus C2 is the concentration gradient. Excuse me. Excuse me. So C1 minus C2 is the concentration gradient. So we can see that the rate of diffusion is directly proportional to the surface area of the membrane and the concentration gradient. If we are speaking of pressure, okay, if we are speaking of pressure, it becomes the pressure gradient. If we are speaking of pressure, it becomes the pressure gradient. And P, or the permeability. Remember, this P, or the permeability, depends upon the characteristics of the substance that is getting absorbed. That means it depends upon the size of the molecule, it depends upon the permeability of the molecule, it even depends upon the charge that molecule is carrying. जैसे kidney में when we study, what happens when we are studying kidney and we study the glomerular filtration barrier, we know that the glomerular filtration barrier has got negative charges. So it is going to repel the negative ions. So therefore proteins are not reabsorbed, or the proteins are not filtered. They are not filtered because they carry a negative charge, and the membrane also has got a negative charge. But positively charged small molecules get easily filtered. So diffusion coefficient depends upon the properties of the substance that is getting transported. Now, this one important shows directly proportional, and remember that the rate of diffusion is inversely proportional to the thickness of the membrane, right? Because the thickness of the membrane means the distance the substance has to travel. So suppose the membrane is this much thick, thick. If you keep on increasing the thickness of the membrane, the distance that is to be traveled by the substance will keep on increasing. Okay, it will keep on increasing, and therefore it is going to result in the it is going to decrease the rate of diffusion. Right? Now, how can you apply this? How can you apply this? How can you apply this? See what happens when we are exercising. When we are exercising, the surface area increases. There is opening up of capillaries. Okay, there is opening up of the pulmonary capillaries, and the surface area increases. And what happens? The rate of diffusion increases. Now, what happens in pathological condition like pulmonary edema, where the thickness of the membrane increases? So when the thickness of the membrane increases, what happens? The rate of diffusion will decrease. What happened in emphysema? There is disruption of the alveoli, the surface area decreases, and therefore the rate of diffusion decreases. So the fixed law of diffusion is very, very important law, boys and girls, for simple diffusion wherever the simple diffusion principles are taking place for absorption. Now, similarly, celiac disease is a condition where you get the Fick law defect. It is called as the Willis atrophy. And because there is atrophy of the Willis, there is decrease in the intestinal surface area. Right? There is a decrease in the intestinal surface area. Right? And as there is decrease in the intestinal surface area, what will happen? Definitely there is going to be an impaired nutrition, and this person will come to you with conditions which will reflect that there is malabsorption, and the symptoms will be related to that kind of malabsorption. Right? So it is also caused by a gluten sensitive inflammation. So simple diffusion, facilitated diffusion. Now, दोनों में से which one is faster? Yes, J. What? Which is faster? Simple or facilitated? Simple or facilitated? Which one is faster as compared? If you compare both of them, which one is faster? Simple diffusion or facilitated diffusion? Anybody? Anybody would like to try? Yes. So remember that facilitated diffusion is faster than simple diffusion, right? Facilitated diffusion is faster than the simple diffusion. Now, can you solve this MCQ? Can you solve this MCQ? Trace B. This trace B is showing which of the event? Sodium dependent transport of glucose, transport of calcium, transport of potassium, transport of sodium, or transport of oxygen across an artificial lipid membrane. Yes, JA, that is hypertensive retinopathy or a hypertensive nephropathy, right? Hypertensive nephropathy. Yes, it is simple diffusion. So trace B is simple diffusion, and in the given options the simple diffusion is the transport of oxygen across the membrane. Yeah. Now simple diffusion and facilitated diffusion share which of the following characteristic? They can be blocked by specific inhibitors. They do not require ATP. They require transport proteins or the transport solute against concentration gradient. Yes, anybody? Yes. So both of them, they carry one important feature, that is they do not require ATP. They do not require ATP. Right? Specific inhibitors का जो block है, that is only shown by facilitated diffusion. Okay, it is shown by facilitated diffusion and not by simple diffusion. And transport protein is required only by your facilitated diffusion, and both of them are not transport against the concentration gradient, but they are transport along the concentration gradient, right? Yes. Now, yes. Now let's come on to our very important topic, that is our primary active transport or active transport. So active transport is of two types. It can be either primary active transport or it can be a secondary active transport. Primary active transport is called primary because they are using ATP and they are causing direct hydrolysis of ATP. Okay, they are causing a direct hydrolysis of ATP, and the energy that is obtained from the direct hydrolysis is used for transport. Secondary is called secondary because it is not causing a direct hydrolysis of ATP, but it is using a gradient that is being established by the primary transport. Now, the most common example of the primary active transport is the sodium potassium pump. Okay, the sodium potassium pump. Most common example is the sodium potassium pump. But apart from that, you must remember that there is hydrogen pump and there is a very important calcium pump. Where is the calcium pump? The calcium pump is present in the muscles, which will pump the calcium out of the sarcoplasmic reticulum. Okay, sorry, out of the sarcoplasm back into the sarcoplasmic reticulum. And the hydrogen pump. The hydrogen pump is present in the parietal cells of the stomach, which secrete your HCl. Hydrogen pump is present in the intercalated cells of kidney, which is responsible to acidify the urine or create a low pH. And hydrogen pump is also present in the lysosomes. Okay, it is also present in the lysosomes. Now, this again comes as an image based question. Okay, so remember that this also comes as an image based question. Now, you can see that it is it is made up of two subunits, alpha and beta. Okay, it is made up of two subunits, that is alpha and beta, where beta is supposed to be only meant for glycosylation. Okay, beta is meant only for glycosylation. It has got glycosylation sites. So the active site or the active one is your alpha subunit. Okay, so the alpha subunit is your active and beta is mainly meant for glycosylation. You can see that there are different sites, binding sites available on the active or the alpha subunit. You have got 3 sites which are present intracellularly and you have got 2 sites which are present towards the extracellularly. So inside you have got a sodium binding site, right? A sodium binding site. You have got a phosphorylation site and you have got an ATP binding site. Whereas on the ECF side, you have got a site which will bind with potassium and coabane, that is digitalis. Right? Now, this this particular pump, it is said that it has got a coupling ratio of 3:2. What do you mean by a coupling ratio of 3:2? It pumps 3 sodium ion outside and 2 potassium ions inside. Okay, it pumps 3 sodium ions outside and 2 potassium ions inside. So 3 positive are going outside and 2 positives are coming inside. That means a net loss of 1 positive ion. A net loss of 1 positive ion. And this pump, because it loses 1 positive ion, is contributing to minus 4 millivolt of resting membrane potential. Right? It is contributing to minus 4 millivolts of resting membrane potential by this losing 1 positive ion. Now, this sodium has to be pumped outside. Okay, because the sodium has to be pumped outside, the sodium will bind inside and the potassium is to be brought inside, and therefore the potassium is going to have a site which is outside. So as soon as there is hydrolysis of ATP and there is pumping of the sodium inside and outside, again you can the binding again the cycle keeps on. It is a pump which is always active, so it is going to be an ongoing process that they will bind and they will be brought inside and outside. So how does it take place is that as the sodium binds, okay, as the sodium binds, and there occurs a conformational change in the molecule. So when 3 sodium ions and 1 ATP bind on the inside, on the intracellular side, there is breakdown of ATP. Okay, there's going to be hydrolysis of ATP, which is going to bring about a conformational change in the structure or the conformational change in this molecule. And because of that, the 3 sodium ions will move out. And the 2 potassium ions which were now outside will be now inside. And the dephosphorylated, this dephosphorylates the phosphorylated aspartic acid. The energy which will be released causes another conformational change. Okay, so the energy which will be released will cause another conformational change and it will result in the entry of potassium inside the cell. Okay, so I repeat, 3 molecules of sodium and 1 ATP are going to bind to the intracellular site, and there's going to be the breakdown of ATP. This produces a conformational change which allows the sodium to move out, that is, they are extruded out from the cell. The 2 potassium ions which will now bind to the outer surface of the molecule. This dephosphorylates the phosphorylated aspartic and energy. The energy which will be released, okay, the energy which will be released will now cause another conformational change and the 2 potassium will come inside. Yes, JA, this is very interesting part where we will be studying in the next session that how does ions are going to affect your RMP, especially what is hyperkalemic periodic paralysis, how does hyperkalemia, how does sodium, how does calcium affects our RMP, that is the resting membrane potential, which is going to be the next class. Okay, which is going to be the next class. This is the class of basically cell membrane and transport across cell membrane. Okay? Yeah. Which place you belong to, JA? Which place you belong to, beta? Can you tell me? Now, what are the functions of this sodium potassium pump? Now, as you have seen, that is an electrogenic pump. Because it is an electrogenic pump, that means it is causing the loss of one positive ion. It is contributing to your resting membrane potential. Remember, it is very, very important to re-establish the resting membrane potential once the action potential is over. And if after the end of the action potential you do not restore the ions back, you cannot generate the next action potential, right? Then this site, which is called as the Coabane binding site, which is digitalis, is very, very important. This is very important. Coabane, or it is digitalis, which is a cardiac glycoside. What is a cardiac glycoside? It is a drug which increases the contractility of the heart, which is very, very effective in the treatment of cardiac failure, which can improve the contractility of heart. So this particular drug inhibits the sodium potassium pump and indirectly favors the intracellular calcium concentration, which improves the contraction of heart. Now, another important function is that this pump, it contributes to your BMR. It is an energy consuming pump. So hormones like your thyroid hormones, the thyroid hormones stimulate the sodium potassium pump, and in this way they contribute to increase in BMR, right? This pump is also very, very important to maintain the shape and the volume of the cell. So suppose if the pump fails, okay, if the pump fails, what will happen? If the pump fails, sodium will keep on accumulating inside the cells, and because the sodium is osmotically very active, water will be drawn into the cells. The cells will swell and burst. But fortunately, we have got the presence of the sodium potassium pump, which prevents the extra sodium to come inside. Now, after we've seen the primary active transport, now let's look upon to the secondary active transport. And now we have to understand that why it is called as the secondary active transport. What is the difference between primary and secondary? Now, secondary active transport can either be a co-transport or a counter-transport. What is co-transport? Co-transport means there are two substances which are coming into the cell. Okay, that means the movement is in the same direction. Two substances which are coming into the cell, that means they are coming, both of them are coming in the same direction. Counter transport means one substance is moving into the cell and the other substance is moving outside. Okay, one substance is moving into the cell and the other is moving outside. That means both of them will have different movements. Now, SGLT, that is sodium glucose transporter 1, it is present in the intestine, and SGLT2 is present in the renal tubules. Now, SGLT is an example of secondary coactive transport mechanism. What is the reason why it is called as secondary coactive transport mechanism? Let's try to understand that. Now see, on the basolateral side, there is presence of a sodium potassium pump. This sodium potassium pump pumps the sodium outside. Okay, it pumps the sodium outside. Okay, JA. Now, as it pumps the sodium outside, it maintains a very low concentration of sodium within the cell. It maintains a very low concentration of sodium within the cell. That means the sodium inside is low, which is creating two gradient. It is creating electrical gradient because the positivity is less as the sodium is moving out. It is also creating a concentration gradient because the sodium is moved out, right? Because the sodium is moved out, the concentration gradient also is less. Now, the primary sodium potassium pump is creating a gradient by causing hydrolysis of ATP and moving the ions outside and inside. What happens over here is there is a co-transporter SGLT which is present on the luminal site. Okay, it is present on the luminal site. This SGLT binds to two substances at a time. What is the reason? If it is only binding to sodium, okay, if it only binds to sodium, it won't function. It will function only if two substances are binding. So why does glucose bind and how does glucose bind? The sodium binds to SGLT and the sodium concentration is less inside. This favors the movement of sodium. The energy which is present is such that it can also allow any other molecule like glucose or even amino acids or could be even some ions to be dragged inside. So the sodium is moving along the concentration gradient and the glucose is moving against the concentration gradient, right? So the sodium in this case is moving along the concentration gradient and the glucose is moving against the concentration gradient. So it is secondary active transport because it is not causing any direct hydrolysis of ATP, but it is using a gradient that is established by the sodium potassium pump. Okay, it is using a gradient that is established by the sodium potassium pump because this pump keeps a very low concentration of sodium inside, which creates a concentration gradient as well as an electrical gradient to favor sodium. Now this is the reason that when in patients, in the patients with dehydration, right? In hello Satyam Roy, hello, nice to see you also. So a very common question that is asked that why do we put sugar when we are making an ORS solution for dehydration? What is the reason of adding sugar? So when you add sugar to an ORS solution, we know that sugar, that is glucose, will get transported only with the help of sodium, that is salt. So sodium and glucose are getting co-transported and both of them are osmotically active and water will be dragged inside. Because of this, water will be dragged inside. So the reason you add sugar is this sugar will not only help in the absorption of glucose, sodium, but also water by the osmotic gradient which will be created. So in the case of this SGLT, the most important dependency of this SGLT is over the sodium potassium pump. If this pump fails, okay, if this pump fails, then this SGLT transport cannot also take place. Can we have some another few examples of co-transports? Yes, any other examples of co-transports? So another examples of co-transports are sodium amino acid, sodium chloride, sodium bicarbonate. Maximally, these transports will be seen in the renal tubules and in the GIT, small intestine. You have got sodium bile salts and sodium bile acids. Sodium bile salts and bile acids in the terminal ileum are very important examples. Then the sodium iodide symporter. Okay, the sodium iodide symporter is another very important example which is important in your thyroid glands as an iodide. Though it is called as an iodide pump, it is basically a symporter. Now, what is a counter transport or an antiport? Here you will see that there are two substances wherein one substance is moving inside and the other substance is moving outside. Right? So you can see that the sodium concentration, as this sodium will be brought inside and the calcium will be taken outside, again the sodium concentration will be kept low because sodium potassium pump is going to take that sodium towards the outside of the cell. So this figure, if you remember, if I just want to enlighten you, uh, digitalis, that is the cardiac glycoside, it inhibits the sodium potassium pump. So this sodium potassium pump will be inhibited by the cardiac glycoside, that is coabane or digitalis. As it inhibits the sodium potassium pump, it is also inhibiting indirectly the outward movement of calcium, because this outward movement of calcium depends upon the functioning of the sodium potassium pump, right? And because of as the calcium cannot go outside, this calcium will remain inside, and as the calcium remains inside, okay, as the calcium remains inside, the force of contraction will increase. Okay, the force of contraction will increase. Yeah, it's digoxin only. Digitalis is digoxin. Okay. Huh. Okay. Another very important example of antiporters. You have got very important antiporter, that is sodium hydrogen. This sodium hydrogen antiporter is coupled with sodium bicarbonate symporter. Sodium and bicarbonate will be reabsorbed together in exchange, which is going to be handled with the sodium and the hydrogen, uh, sodium and hydrogen, this thing, antiporter. Ja, this acidosis and alkalosis. As I told you, there is a very important co-transporter, that is sodium bicarbonate in the PCT, which is acting, or which is, coordinating with the antiporter, that is sodium hydrogen, which are taking part in this acidosis and alkalosis in the PCT. Now, remember we started with a case history where I told you that a case history of a person who was diagnosed with peptic ulcer and what proton pump is being used. So, uh, in the case of peptic ulcer, the main reason is an increase in the acid secretion. In the parietal cell of stomach, there is a primary hydrogen ATPase pump. So that primary hydrogen ATPase pump is inhibited by the proton pump inhibitors like omeprazole, Pantop, okay, pantoprazole, right? This hydrogen potassium pump is an example of a primary active transport. So this is the way how the clinical questions are framed as far as physiology is concerned. Now, moving on, next is your osmosis. Again, osmosis is a passive transport. Okay, it is a passive transport where is related mainly to the movement of water. Okay, it is related to the movement of water, that is solvent. So you can see that here on one side across semi-permeable membrane, the concentration of water is more, and on the other side, the concentration of solute is more. Now, wherever the concentration of solutes will be more, especially impermeable solutes, okay, especially impermeable solutes like sodium chloride, they are going to create an osmotic effect and drag the water, okay, drag the water. So Osmosis is a very, very important mechanism of reabsorption of water, again in the GIT as well as in the kidney. Now moving on, next is vesicular transport. So now, till now you have seen that there is primary active transport, there is secondary active transport, and now there is something which is called as vesicular transport, where there is transport by formation of vesicles. Okay, there is transport by formation of vesicles. It can be exocytosis or endocytosis. Exocytosis means you are excreting or throwing the substance outside, and endocytosis means you are internalizing the vesicle. That means you are taking the vesicle inside. Again, this endocytosis can be phagocytosis or pinocytosis. Pinocytosis is for small water molecules and phago is for big one, right? Now remember that this endo and exocytosis are, again, they are active processes. They require energy, right? They are active processes. They require energy. And endocytosis especially uses clathrine. It is also called as a clathrine mediated endocytosis. Okay, it is called as a clathrine mediated endocytosis. It is three-legged or a triskelion, triskelion which helps, or a filamentous protein which helps in the reabsorption of substances. Exocytosis is of two types. It can be constitutive or a non-regulated exocytosis, and regulated exocytosis which is non-constitutive. Regulated means what? Regulated means there is pre-processing of the substances. For example, protein hormones, they are pre-processed in the endoplasmic reticulum, in the Golgi apparatus, before they are completely released. Okay, before they are completely released. Whereas non-regulated may, they are continuously secreted. For example, the secretion of the mucus by the goblet cells. Okay, secretion of the mucus by the goblet cells, or secretion of the IgG, then the fat soluble hormones. No processing is required, but regulated may a processing is required. Remember, the protein hormones are always, the protein hormones are always synthesized as pre-pro hormones. Like suppose if it is insulin, it will be pre-pro-insulin, pro-insulin, and then insulin, right? So that regulated exocytosis is done, or this processing is done basically in the endoplasmic reticulum and Golgi apparatus. Now finally, there is something important which is just a short note which we get sometimes on distribution of the body fluids. The first important thing to be remembered is that 60% of the body weight is water in adults. Okay. So, out of that 60% of the body weight, we have got 60, 40, 20. Okay, 60, 40, 20. That is 40 will be your ICF and 20 will be your ECF. So, in a man weighing 70 kg with 42 liters of water, 28 liters is going to be ICF and 14 liters is going to be your ECF. So ECF is 1/3 of total body water, and ICF is 67% of, or 2/3 of the total body water. So remember, the water which is only inside the cell is ICF, only inside the cell, right? Whereas the water outside, that even plasma, will be your ECF, right? So this ECF also includes your plasma and your interstitial fluid. Your plasma and your interstitial fluid are extracellular fluid. Also, the transcellular fluid, that is the fluid which is present in the body cavities, is also your ECF, right? The pericardial, the CSF, the pericardial fluid, the pleural fluid, the synovial fluid, these are examples of transcellular fluid. They are very, very less in amount because they are just meant for lubrications. Very less in amount. Okay? Only they will be countable or measurable when they rise abnormally. So, the total body water is 0.6 of body weight, ICF 0.4, ECF 0.2. Interstitial fluid is 75% of your ECF and plasma volume is 25% of your ECF. And remember that blood is 8% of body weight. Right? So, this is all with today's session, where I've mainly concentrated on the transport processes because it comes as an LAQ and very, very important MCQ also. And we just looked upon through celiac disease with the help of the fixed law, and we also looked upon on the peptic ulcer, a proton pump inhibitor as a case-based scenario. In the next class, I'll be completing the genesis of resting membrane potential and the action potential. Okay? I hope the class was useful and happy learning. Thank you and good night.